For my pediatric patients, when I'm explaining results to parents, I typically keep the results very short, sweet, concise for them. But for our adult patients, I like to add a little bit more detail so that they have all the information that they need and can really be educated and informed to make the best decision moving forward. So if I have a patient with this kind of loss here, this is how I would explain it. I would say something along the lines of, hey, we did your hearing test today and we put it here on this graph called an audiogram. This is how we plot your hearing. As we move across the top from left to right, we're looking at low bass sounds all the way to high treble sounds. You can kind of think of it like keys on a piano from low to high. And then as we move from top to bottom, we're going very soft to very loud sounds. So the further down I go, the louder I have to make it in order for you to say that you've heard it. Now, when we're looking at, how much hearing loss you have, anything above this 25 decibels, this 25 range here and above is normal. And so what I'll do for the patients, I'll flip the bottom of the page up and kind of draw a line there so they can see what is in the normal range. And then I'll remove that and unfold it back down and say, and everything below this is showing hearing loss. So we're seeing a fair amount of hearing loss and in both ears. Those red circles are your right ear. The blue X's are your left ear, and here we're seeing that it's pretty much the same in both ears, which is good. Our ears go everywhere with us, so we ideally want the hearing to be the same. You just have a lot of hearing loss in both ears. And so when patients like you come in and you're telling us things like, I hear things fine, but I can't quite understand things, this is the type of graph that I expect to see, because these low pitches help us with audibility, how well somebody can hear. You got a little bit of loss here, but I can imagine that you would feel like you could hear things okay. But as we drop off in these higher pitched sounds, that's where the clarity of speech comes in. So this is where your consonants live. So you may have trouble differentiating between words like sat, hat, cat, fat, that. You might hear the ah or even the at part very clearly because that's our vowels in the low pitches, but those beginnings and endings of words are unclear. Does that make sense to you? Does it sound like what you're experiencing? Most of the time, the patient will say, yes, that's exactly what I'm experiencing. And then from here, we can move into counseling on hearing aid options. You also want to make sure to give them opportunities to ask questions. Maybe you weren't clear on certain parts, or they just needed a deeper explanation of certain things as well. So you want to make sure to give them different opportunities throughout your explanation for them to ask questions of you.